important chart, few important tables from orthopedic. So the first table is common dislocation at a different joint. Common dislocation at different joint. Common dislocation at a different joint. Then what are the joints and what is the dislocation there? So spine, in a spine, in hip, in shoulder, in elbow, in wrist, MP joint, metatarsophalangeal joint, knee joint, patella, ankle, and in foot. In foot we have intertarsal and tarsometatarsal. So intertarsal is called chopard dislocation. Chopard dislocation is intertarsal. Chopard. And tarsometatarsal is Lisfranc. Lisfranc. So chopard is intertarsal and Lisfranc dislocation is tarsometatarsal. Then in ankle, anterolateral, ankle, anterolateral side. Okay. For patella, lateral. For knee, posterior. MP joint, metacarpophalangeal joint, dorsal. It goes dorsal, that is index finger. In wrist we will have lunate and perilunate dislocation. Lunate and perilunate. In elbow most common is posterior and posterolateral. Posterior and posterolateral. In hip we will have posterior or anterior. In spine we will have cervical spine, anterior C5 over C6, anterior C5 over C6. In shoulder, anterior most common overall, anterior and posterior can also occur. Next is important point here. Dislocation means complete loss of contact between articulating bone. Dislocation means complete loss of contact. Complete loss of contact between articulating bone. Treatment of acute dislocation is an emergency. Treatment of acute dislocation is an emergency. Shoulder is the joint to dislocate most often. Shoulder is a joint to dislocate most often. And last, typical deformity in dislocation. Typical deformity. What is the typical deformity in dislocation? Joint dislocation and deformity. What will occur in shoulder anterior? Shoulder if anterior, elbow if posterior, hip if posterior or anterior, in knee and ankle. So deformity in joint dislocation. Ankle में क्या होगा? Varus will occur in ankle. Similarly, shoulder anterior में abduction deformity. Abduction anterior गया तो abduction नहीं होगा. Elbow posterior गया तो flexion deformity. Flexion. Similarly, hip posterior गया तो flexion, adduction, internal rotation. ठीक है. Similarly, anterior आया तो abduction and external rotation. So the difference is flexion in posterior and internal rotation. And next one is adduction for anterior dislocation, external rotation and abduction. And last, knee flexion and external rotation. And for ankle, varus will occur. Varus. For elbow posterior flexion deformity and shoulder anterior is abduction deformity.